Welcome to Final BDS Made Easy. In this video, we are going to discuss the one-marker questions from the subject of Oral Medicine and Radiology. Question number 1 is line focus principle. Benson's line focus principle is a concept that improves image sharpness while reducing the heat load on the X-ray tube. It involves angling the anode target about 6 to 20 degrees to the central ray of the X-ray beam so that the effective focal spot size is smaller than the actual focal spot size. Name radioisotopes used in dentistry. Radioisotopes used in dentistry include technetium-99m, uranium-234, and iodine-131. These isotopes are commonly used in diagnostic imaging, such as in bone scans, to detect abnormalities in dental and maxillofacial structures. Number 3 is name any 4 lesions which shows displacement of teeth radiographically. They are odontogenic cysts, example dentitory cyst, ameloblastoma, central giant cell granuloma, and odontogenic myxoma. Question 4 is effects of increased peak kilovoltage on image. Increasing peak kilovoltage on radiographic imaging results in increased image density, that is darker image, and decreased image contrast, making it easier to visualize structures with varying densities. Question 5. Antifungal medicines used for oral candidiasis. These are nystatin 1 lakh units per milliliter suspension, swish and swallow 4 to 5 times daily, clotrimazole 10 milligrams lozenges, dissolve 1 lozenge in the mouth 5 times daily, fluconazole 100 to 200 milligrams once daily for 7 to 14 days, and itraconazole 100 milligrams once or twice daily for 7 to 14 days. Question 6. Give radiographic differential diagnosis between lateral periodontal cyst and globulomaxillary cyst. Lateral periodontal cyst appears as a well-defined unilocular radiolucency located laterally between the roots of vital teeth, usually in the mandibular, premolar, or canine region. And globulomaxillary cyst appears as a well-defined inverted pear-shaped radiolucency located between the roots of the maxillary lateral incisor and canine, causing divergence of these roots. Number 7 is diagnostic criteria for MPDS, that is myofascial pain dysfunction syndrome. Laskin's criteria includes 4 positive cardinal signs, that is unilateral pain, muscle tenderness, clicking or popping in TMJ, and trismus. 2 negative signs include the absence of clinical, radiographic, or biochemical changes in joints itself, and lack of tenderness in TMJ region. It is Sturge-Weber syndrome. It is a rare congenital disorder characterized by a facial port wine stain, typically in the distribution of the trigeminal nerve, leptomeningeal angiomas, which can lead to neurological symptoms such as seizures, and glaucoma, which can affect vision. Question 9 is inverse square law. In free space, all electromagnetic radiations obey the inverse square law. It states that for a point source, the radiation intensity, that is I, at any place varies inversely as the square of the distance, that is d, from the source to the place at which the intensity is being considered. I is inversely proportional to d square, or I is equal to 1 by d square. Number 10 is 3 ways by which we can reduce deleterious effects on image sharpness. These are, first is use of small focal spot size. Smaller focal spots produce sharper images by minimizing penumbra effects. Next is minimize patient movement. Ensuring patient cooperation and using appropriate immobilization techniques can prevent motion blur. And last is optimize exposure factors. Correctly setting the voltage and current parameters based on the anatomical area and patient size helps in achieving optimal image quality with sufficient detail and contrast. Number 11 is latent image. A latent image is the invisible image formed on the X-ray film after exposure, which consists of neutral silver atoms. It becomes visible after the film undergoes processing by converting neutral silver to metallic silver. Question 12 is various indications for water's projection. First is an evaluation of maxillary, frontal and ethmoidal sinuses, then detection of orbital fractures, assessment of midfacial fractures, and when open mouth waters was taken, we can see the sphenoidal sinuses also. Question 13 is differential diagnosis of gingival polyp and pulp polyp. Hypoplastic pulpitis, that is, pulp polyp, should be differentiated from proliferating gingival tissue, that is, the gingival polyp. It is done by raising and tracing the stalk of tissue to check whether it arises from gingiva or pulp. Gingival polyp is a benign localized overgrowth of gingival tissue typically resulting from chronic irritation or trauma, and it is not associated with the pulp of the tooth. Whereas pulp polyp, it is also called chronic hypoplastic pulpitis. It is an overgrowth of dental pulp tissue protruding through a carious lesion in the tooth, usually seen in teeth with large open cavities. Question 14 is define leukoplakia. In 2005, WHO defined leukoplakia as a white patch or plaque of questionable risk having excluded known diseases or disorders that carry no increased risk for cancer. Question 15 is name various papillomatous lesions of oral mucosa. These are squamous papilloma, verruca vulgaris, condyloma acuminatum, and focal epithelial hyperplasia, also called Hex disease. Question 16 is treatment of primary herpetic gingivostomatitis. First is to relieve pain, we can prescribe analgesics, either topical or systemic. That is 2% viscous lidocaine, swishes and spit out 5 milliliters 4 to 5 times a day. Then to maintain proper fluid balance, fluid replacement should be done, hydration should be maintained. Then in mild to moderate cases, topical drugs with antiviral drugs like acyclovir 5% cream to be applied 3 to 4 times a day for 7 days, and in severe cases to prevent further reinfection, systemic antiviral drugs like acyclovir 200 to 400 milligrams 5 times a day for 7 days. Question 17 is 3 causes of trismus. These are oral infections such as pericoronitis, trauma or surgery, and radiation therapy, which can cause fibrosis of the muscle and tissues, and tetanus. Question 18 is penny coin test. The penny test is used to evaluate the safe light conditions. It involves placing a penny coin on a film or an unexposed film cassette and exposing it to the safe light for a specific duration. After development, the test helps determine whether the safe light is safe for use with the specific film type by assessing any fogging or unwanted exposure on the film caused by the safe light. Number 19 is diascopy. It is a test for blanchability performed by applying pressure with a finger or glass slide and observing color changes. It is used to determine whether a lesion is vascular, that is hemangioma, or non-vascular, example mucocele, or hemorrhagic like petechiae or purpura. You put a slide over the lesion and apply pressure and then check for blanching. Hemorrhagic lesions and non-vascular lesions do not blanch while vascular lesion gets blanched. Then 3 causes of palatal perforation. These are chronic infections such as syphilis, direct trauma or surgical procedures, and squamous cell carcinoma. Also granulomatous diseases such as Wegener's granulomatosis. Number 21 is acute and chronic ulcer associated or predisposing with smoking. Acute ulcer may often be linked to trauma or irritation from smoking, presenting as a painful, shallow lesion with surrounding erythema. Chronic ulcer, on the other hand, is typically seen in long-term smokers, and it may indicate more serious conditions like oral squamous cell carcinoma, presenting as a non-healing indurated ulcer with irregular borders. Number 22 is the tire track pattern on radiograph. Car tire-like pattern on intraoral radiograph is seen when film is exposed from the lead foil side. Question 23 is herpetic whitlow. Herpetic whitlow is a viral infection caused by herpes simplex virus, primarily HSV1 or HSV2, often contracted by healthcare workers, and it affects the fingers of hands. It manifests as painful clustered vesicles or ulcers on the fingers, often acquired through contact with infected oral secretions. 24 is Sutton's disease. It is also known as recurrent aphthous major, Mikulicz carrying aphthy, or Sutton disease. It is characterized by occurrence of large painful ulcers, usually from 1 to 10 in number, on the lips, cheeks, tongue, soft palate, and facial pillars. These lesions may exceed 1 centimeter in diameter and persist for up to 6 weeks and leave a scar upon healing. Thank you for watching. If you appreciate this video, do hit the like button, share it with your friends, and please subscribe to my YouTube channel and press the bell icon for more regular updates.